another question we had was about manipulations. For those of you who don't know, a manipulation is kind of like cracking your knuckles or cracking your toes or any cracking your neck. Sometimes that happens. And usually, from what I know so far, unless other research comes out, it's like air bubbles trapped in a joint, and then you are compressing the joint space tightly until that air bubble pops. And sometimes once that air bubble pops or whatever happens in there happens, usually there's a nervous system reaction of relief. So let's just say you got a hip problem and your hip pops in a good way, I guess, and then you're like, oh, it feels so much better. Sometimes that release of the gas bubbles triggers a nervous system response, and then that triggers your muscles and tissues around there to kind of respond in a better way. Hope that makes sense. Hope that's simple enough. And the question was, when should we do them or when should we not? Usually, we need to be very cautious around the spine when deciding whether to do them or not, but you can also be cautious around the hip or the ankle or the knee as well, because most joints, if not all of them, do have the ability to manipulate or have a traditional manipulation process. So let's start with the spine. In school, were you given like any protocols or anything to be aware of?
Just probably not immediately after a surgery. Also, in your like palpations, kind of assess your patients, how much they're guarding, how much they seem apprehensive. If they seem more on the apprehensive and guarding side, probably not in the initial encounter, but as build patient rapport and things like that, maybe later on in your treatment sessions, maybe that could be a good time to perform a manipulation.
Okay, cool, good. There are some protocols or contraindications in school. I forgot all of them. I would have to use Google to get all, I don't know, 4, 5, 6 of them.
Yeah, like hematomas or things like that,
Right,
contraindications.
right. And for those of you who don't know, that means don't do them, right? So what I usually do now is the big one I remember is, or remember, the big ones I remember are like, of course, after surgery, especially if they have hardware in the spine, of course, we're not going to do that. Over 65 is coming to mind, and apprehension are the other ones coming to mind. So usually people nowadays, they just ask for it, and if they ask for it, that's a good sign that they've had it before, they didn't have any problems, they want it again, and usually I just ask, well, did you have any surgeries? Is there any hardware I should worry about? Any recent like lightheadedness or anything going on, especially in the neck if they want a neck manipulation?